kindly confirm if you can see my screen.
Yes, I can see your screen, Lucy.
All right, thank you so much. Thank you so much. All right, good afternoon, distinguished guests, esteemed speakers, partners, colleagues, ladies and gentlemen. On behalf of Pinecrest Healthcare Limited and Biorad Laboratories, it is my pleasure to warmly welcome you to today's webinar. Our theme for today's webinar is your chemical pathology laboratory quality assured? My name is Lucy Dansufo, a field application executive of Pinecrest Healthcare Limited, and I have the privilege of serving as your moderator for today's webinar. We are delighted to have medical laboratory scientists, pathologists, clinicians, healthcare professionals, and other stakeholders joining us today. Thank you for taking the time to be with us. Before we begin, we are here are a few announcements, housekeeping announcements, microphones muted throughout these presentations. Questions can be submitted through the chat or QA section during the presentation. We encourage your active participation during the discussion section. Should you experience any technical difficulties, our support team will be available to assist you. Without further ado, let us begin. To officially commence today's webinar, it is my honor to invite the Medical Director of Pancreas Healthcare Limited, Dr. Chijioke Onya, to deliver the opening remarks, who is humbly represented by our Field Application Manager, Ms. Eunice Onwuchika. Ms. Eunice, your floor is yours. Thank you.
Thank you so much, Lucy. Good afternoon, distinguished guests, ladies and gentlemen. I wish to, on behalf of my Managing Director, Dr. Chijioke Onya, who is unavoidably absent, to extend our warm welcome to all the distinguished speakers, the esteemed guests, industry professionals, colleagues, and every participant who is joining us from different locations. We are truly grateful that you were able to join us today. Quality assurance is more than a set of procedures or standards. It is a commitment to excellence, continuous improvement, and delivering consistent value. So whether we actually work in the healthcare, in the laboratory service, or any other industry, quality remains the foundation of trust, safety, and customer satisfaction. So today's webinar is going to provide an excellent opportunity to strengthen our understanding, share best practices, and explore innovative approaches to building and sustaining a culture of excellence. Our theme today is in form of a question. Is your chemical pathology lab quality assured? And while we go through the topics that we have in store today, you're going to answer that question for yourself. And today's theme also reminds us that quality is not the responsibility of one person. It is a shared responsibility for everyone. If you're in the management team, if you're on the bench, or in whatever role you play in the medical laboratory, quality is your business. So I encourage everyone to participate actively. Put in your questions in the chat box, as our moderator has told us, and give us your opinion at the end of the sessions. Our speakers are well prepared for you. And as you can see, they're already here with us today. And we trust that you're going to have your time well spent with us today. So feel free, relax. Like I said before at the beginning, remind other people who are not here, let them come so that everyone can pick a nugget or two by the end of today. Thank you so much for coming. Over to you, Lucy.
Thank you so much, Miss Eunice Onchikwa. I'm really, really grateful for that speech.
I've been
For
able to.
we are really grateful for that, for inspiring this opening remark and setting the tone for today's webinar. Thank you so much. So the next agenda on our list is welcome remarks by Dr. Eluchukwu. It is now my pleasure to invite Dr. Eluchukwu, Managing Director of L Lab Limited, to deliver the welcome remarks. Thank you. The floor is yours, sir.
Thank you very much. Can you hear me, everybody?
Yes, sir,
Yeah,
we can.
hear you.
Thank you. Good afternoon, distinguished guests, respected facilitators, representatives of Biorad Laboratories, United States of America, Pinecrest Health Care Limited, esteemed colleagues, ladies and gentlemen. It's my great pleasure and privilege to welcome you all to today's webinar with the theme, Is your chemical pathology laboratory quality assured? I would like to sincerely commend Pinecrest Healthcare Limited and Biorad Lab USA for organizing this timely and highly relevant educational event. Your commitment to advancing laboratory quality through continuous professional education and global collaboration is truly commendable. The medical laboratory remains the cornerstone of modern healthcare. It is widely recognized that the majority of clinical decisions are influenced by laboratory test results. Consequently, quality, accuracy, and reliability of those results directly affect diagnosis, treatment, monitoring, and ultimately patient outcomes. However, producing accurate laboratory results does not happen by chance. It requires comprehensive quality management system that encompasses the pre-analytical, analytical, and post-analytical phases of testing. One of the most critical components of this system is proficiency testing, otherwise known as EQA, External Quality Assessment. Participation in EQA provides an independent assessment of a laboratory's performance by comparing its results with those of peer laboratories using standardized samples. It helps laboratories identify hidden errors, verify testing accuracy, improve staff competence, strengthen confidence in reported results, and demonstrate compliance with international quality standards such as ISO 15189. Presently, 2022 is being operated. Today's team therefore asks one important question. Is your chemical pathology lab quality assured? The question every laboratory professional and laboratory manager should honestly reflect upon. Quality assurance is not merely by accreditation or about accreditation certificates or by passing inspection of regulatory agencies, either in states or national. It's about cultivating a culture of excellence, continuous improvement, accountability, and unwavering commitment to patient safety. So as lab professionals, we have a shared responsibility to ensure that every result you release from your lab is accurate, reproducible, and clinically reliable. You must also consider important factors like laboratory water for accurate diagnosis in clinical chemistry lab. Every sample represents a patient who deserves the very best we can offer. I therefore encourage everyone here participating to actively engage with each other and with our distinguished speakers. I know they're really distinguished. Ask questions, share experiences, and take full advantage of the wealth of knowledge that we presented. I have no doubt that today's discussion will strengthen our understanding of proficiency testing and reinforce our collective commitment to quality laboratory practice. Once again, congratulations, Pinecrest and Biorad Lab and all the invited guest speakers for this valuable initiative. And I thank all of you for your participation and investing your time in continuous professional development. I wish you all a highly productive and informative and impactful webinar. Thank you very much, and do have a wonderful session ahead. Thank you.
Thank you so much, sir. We are very, very we appreciate you, Dr. Elochukwu. We appreciate your kind words. So after that, before we go to the next agenda, I would like to make welcome the outgoing GMLD chairman of the Lagos chapter, Dr. Abimbola Adekoya, and Nirvana from Exiles. You are highly welcome. You know, I would like to welcome every guest because every one of you here are actually special to us. So, our next speaker is to give us a good message, which is Mr. Stanley Ogbonna. Mr. Stanley Ogbonna is the General Manager, Health Focus Diagnostics Nigeria Limited, Enugu. Sir, the floor is yours. Thank you.
Wow. Good afternoon, everyone. Can you hear me?
We can hear you, Mr. Stanley.
Oh, great, great. Lucy, it's nice to hear from you again. Um, good af. Can you hear me? Okay, I can just go ahead then. All right. Good afternoon, everyone. It's really a privilege to bring goodwill greetings on behalf of Health Focus Diagnostics Nigeria Limited to our partners, Pinecrest Healthcare Limited and Biorad, and to everyone joining this webinar on the theme, is your chemical pathology laboratory quality assured? You see, this is a question every diagnostic professional in this room should be asking ourselves regularly because chemical pathology results don't just sit on a report. They shape treatment decisions, guide clinicians, and ultimately determine patient outcomes. A result that isn't quality assured isn't just a technical gap, it's a risk to the very people who trust us with their health. At HFDN, quality assurance isn't an abstract compliance exercise for us. It's embedded in our day to day operations, from internal quality control and EQA participation to competency assessments for our analysts to our ongoing alignments with ISO 15889 2022 standards. Most of this, which would not be possible without the partnership of Biorad and Pinecrest Healthcare Limited. We've seen firsthand how disciplined quality systems don't just protect patients, they build trust with referring physicians, strengthen HMO and partner relationships, and ultimately drive better business outcomes for the laboratory itself. So, a theme like this, one couldn't be more timely. Chemical pathology, in particular, carries uniquely quality challenges. It carries unique quality challenges from analyzer calibration and reagent lot variability to turnaround time pressures and the ever present need for robust LV monitoring, LJ monitoring. Getting this right requires deliberate systems, not just good intentions. I would like to, from the bottom of my heart, thank Pinecrest Healthcare and Biorad for creating a space like this where we can interrogate those questions honestly, share practical solutions, and learn from one another's experience. Because quality assurance is not a destination we arrive at once, it's a discipline we practice continuously. To everyone tuning in, whether you're a lab scientist, a quality manager, like the wonderful person that I'll be speaking today, or a pathologist or a laboratory director, I encourage you to engage fully, ask the hard questions, and walk away with at least one actionable step to strengthen quality in your facility. Because no matter how much we deliberate or how much we discuss, it means nothing unless we carry what we've learned and go to the real world and implement them. Once more, On behalf of the entire HFDN team, I wish you a rich, thought provoking, and productive session. We look forward to the insights that will come out of today's discussion. Thank you and enjoy the rest of the program. Thank you.
Thank you so much, Mr. Stanley. Thank you for giving us these good messages. This good message, rather, we are actually very, very related to. Always having. It's a very nice time to hear your voice. It's been so long. Thank you so much. So now we move to the first presentation. So our first presenter would be Mrs. Blessing, who is the Deputy Laboratory Manager, L Lab Limited. Can you see my screen? Can you see my screen?
Yeah, yes, we
We
can see
can
your
see
screen.
you.
Yes.
All right. So meet our speaker, Mrs. Blessing Wakobi, who is a Deputy Laboratory L Lab Limited. Mrs. Blessing Wakobi is an accomplished quality assurance professional with extensive experience in laboratory quality management system, regulatory compliance, and continuous quality improvements. During her time as a quality assurance manager of L Lab Limited, she played a pivotal role in ensuring that laboratory operations consistently met national and international quality standards while supporting excellence in diagnostic services. She has led 3 successful laboratory audits and played a key leadership role in the laboratory's transition to ISO 15189-2022 accreditation, successfully coordinating compliance with both MLSCN and NINAS requirements. With a strong background in laboratory science and quality management, Mrs. Nwakobi has led the implementation and monitoring of quality assurance programs, internal audits, risk management initiatives, document control systems, and corrective and preventive actions (CAPA) processes. Her expertise spans Her expertise spans laboratory accreditation requirements, quality system implementation, method validation, proficiency testing, and the establishment of robust quality management frameworks that enhance accuracy, reliability, and patient safety. Throughout her career, she has been actively involved in developing standard operating procedures, mentoring laboratory professionals, coordinating quality improvement initiatives, and promoting a culture of excellence across multidisciplinary teams. She's passionate about strengthening laboratory systems through evidence-based practices, continuous staff development, and the adoption of each of international best practices. So, and speaker on topics MS, quality assurance, accreditation readiness, internal audit, risk management and corrective and preventive control and process standardization, and patient safety and laboratory excellence. Known for her practical, engaging, and solution-oriented approach, Mrs. Blessing Wankobi is committed to empowering laboratory professionals with the knowledge and tools needed to build sustainable quality systems that improve diagnostic accuracy and healthcare outcome. Her presentation combined technical expertise with real-world experience, making her a highly sought-after speaker for scientific conferences, professional development workshops, laboratory quality forums, and healthcare leadership events. Ladies and gentlemen, let us make welcome Mrs. Blessing Nwakobi, who is a deputy manager of L Lab Limited. Mrs. Blessing Nwakobi, the floor is yours. Thank you.
Thank you, Lucy, for such a wonderful, I would say, narration about me. Good afternoon, everyone. Good afternoon, Pinecrest team. Good afternoon, distinguished guests, and all participants here present. I want to thank the Pinecrest team and the Barra team for such a wonderful opportunity for me to be here present today to share on this topic. Is your chemical pathology lab quality assured? Permit me to also appreciate and recognize the MD, CEO of L Lab Laboratories Limited, whose passion and commitment to quality has built a foundation in which I am able to be here present to speak on this subject. So I'll be sharing my slide with you as we go so we can take on the topic. Just give me some time. Okay, can you confirm? Lucy, can you see my slide?
Yes, I can see your slide.
Okay, thank you very much. We'll be talking on this topic. Is your chemical pathology lab quality assured? Daily clinicians make decisions based on our laboratory results, and these decisions could be to manage patients, diagnose diseases, or whatever the reason for the test request is. But then laboratory reports becomes only valuable if it is accurate, timely, precise, and reproducible and reliable. So if we do not meet all these in our reports, that report is as good as no report.
Hi, Mrs. Blessing. Please put your presentation on slideshow, please. Thank you.
Okay, thank you so much for that. Are we okay now?
Yes, I think
Yes,
it's
yes,
okay.
thank you.
Thank you. So, like I said, if your result does not meet this criteria of being timely, accurate, reliable, reproducible, it's as good as no report. So, as we dive into this topic, we'll be taking through these outlines. We're looking at the introduction and definition of quality assurance, the exploring the benefits of quality assurance. Then we look at the framework in the laboratory testing, pre-examination, the examination and post-examination phases of the laboratory testing. Shall be looking at the quality assurance in all these phases. Shall also be looking at the common sources of errors that could come in chemical pathology, performance metrics. This has to do with the quality indicators that we use to assess our performance in the laboratory, limitations, and of course, continuous improvement in chemical pathology. So our introduction, chemical pathology plays a vital role in patient care by providing laboratory results that guide diagnosis, treatment, and disease monitoring. The accuracy and reliability of these results are essential for effective clinical decision making. So quality assurance provides a systematic framework for ensuring that laboratory results remain accurate, reliable, timely, reproducible, and fit the clinical purpose in line with ISO 15189-2022. So an effective quality assurance spans across the entire workflow, the pre-examination, examination, and post-examination phases. Reducing errors in these three phases does not only improve diagnostic accuracy, but also directly optimizes clinical outcome and patient safety. So I want us to think of it like a patient comes to the lab, let's say, for instance, wants to run a glycated hemoglobin test, and they want to do this test to maybe adjust the insulin regimen for this patient, and you give an incorrect result to the clinician. The patient's adjustment will be made based on these reports you have given to the clinician, And this remember that this was made out of an incorrect result, and the patient will have this prescription for a very long time. So you see that everything from the accuracy down to the reports going out on time is important when we are talking about quality assurance. So now, what is quality assurance? Quality assurance is a part of quality management system. We know our quality management system. We have our 12 quality essentials, and it is part of the process improvement. It's a part of quality management system focused on providing confidence that quality requirements will be fulfilled. It's also a planned and systematic set of activity implemented to ensure laboratory services consistently meet specified quality requirements. So in essence, what we are saying here is that you have to, the results must be accurate. The right result will go on the right at the right time with the right specimen to the right patient with result interpretation based on correct reference dates and the right place. So we can also look at it generally, differentiating between quality assurance and quality control. Many people have this confusion. So quality assurance is the entire system. It's what happens from the time a test is ordered down to when the patient gets the report. So it carries the entire process. While quality control only checks day-to-day that the day-to-day activities, what the checks that are done in the lab for you to assure that each process is controlled. So it is just a part of the quality assurance. So we look at the benefits of quality assurance. When you implement quality assurance in your laboratory in the chemical pathology, you start to gain much more benefit than you can imagine. Then the first of benefit you get is the patient safety, which is the most important. It prevents misdiagnosis of reports. There will be no wrong result that will be given. Accuracy and precision will maintain. Accuracy is how true a value is, how degree of the degree with which your result is to the true value of that sample. Let's say the sample is supposed to be 100 milligram per dl. If your own how close your result is to the true value is what I mean by accuracy. By precision is how you're able to get the same value in a repeated time. So regulatory compliance is also one of them. You get to meet the compliance requirements, which for the medical laboratory is ISO 15189, reduces turnaround time. When you have issues for like rebleeding, for instance, you have to go call the patient, and patient comes back, you collect another sample. That alone has increased turnaround time, and you have also delayed the time with which the patient will get care. Legal protection, QMS on its own provides you with legal protection because your documentation defends you in terms of dispute. Enhanced risk mitigation, you get to proactively do your risk assessments. When you're looking at quality assurance in total, you do a risk management, you do your risk assessment and assess risk and make plans to mitigate such risks before they occur so that it won't affect the patient. Boost stakeholders trust. It of course give confidence to whatever you do because your result is correct. And then cost saving, getting to run a quality lab might seem expensive, or maybe you are spending so much, but it does not equate to the quality of what you are giving out. Then we said we are going to be looking at the entire phase of testing in this session. So we are going to be looking at quality assurance in the pre-examination phase. We shall be looking at it in the examination and post-examination. So pre-examination phase has to do with immediately you get a call or a patient walks into your facility. From the time a test is ordered down to when the sample gets to the facility, to the laboratory for analysis, is the pre-examination phase. Then we are going to be looking at the quality assurance in this phase. The examination is the testing itself, what happens during the testing, and post-examination, which entails the dispatch and release of results. So in the pre-examination phase of the quality assurance, we'll be looking at the patient preparation, of course. Patient comes to the lab and the patient is meant to have a fasting test. You don't prepare the patient ahead and the patient comes, you're like, don't you know you're meant to fast? Or the patient has come already and you want to take the sample. Probably the patient had eaten and it was the fasting test. Once you collect that sample and report as fasting blood sugar or fasting lipid, you've already mitigated the essence of that result, because the doctor will not be able to accurately interpret that result you have given out. And sample collection and labeling, this part is very important. You know that the higher percentage of errors that happen in the lab are in the pre-examination phase of the laboratory testing process, because these errors that happen in the pre-examination phase, most times it gets to go unidentified. If you label a sample container incorrectly, before the sample will even get to the lab, analyze, and maybe sample discarded, no one will know that you have swapped a particular name. Maybe you've taken John for Peter and you must have swapped it in the pre-examination phase. No one will identify that. And before it gets to come out, maybe the patient must have gotten a treatment that is not for them. So this phase of testing, it's very important that we put an eye to it, because it constitutes higher percentage of error in the lab. Correct patient identification. You must match your form with what you have in your sample in case you're receiving a sample and a request form. And then if it's a patient that is in front of you, you don't just assume that you've called a patient in and this sample belongs to this patient. You must call out the name, identify the patient in front of you, and equally introduce yourself before you go ahead to collect sample. That way you have properly identified a patient. And I also advise for cases of misidentification, it's also important that you attend to one patient at a time, irrespective of how many volume or crowd you have. That way you will avoid misidentification of names or incorrect labeling as well. Then use of correct collection tubes, that is there, because you can't collect on a wrong tube, and if the patient goes, you're calling the patient back for another sample collection. Of course, I believe the lab will not analyze using the wrong container. So you have to delay the patient testing and call back the patient. Proper specimen labeling to prevent misidentification. We already addressed this. Sample processing and transport. In this phase of testing, sample processing and transport has to do with separating the sample in cases where the samples are meant to be performed as a plasma, removing the plasma from the whole blood timely without letting it affect, like sugar, when you leave your fasting blood sugar on a desk, glycolysis starts taking place if you don't separate the plasma immediately from the whole blood. But then there's something we do that we don't really know that it is wrong. When you're collecting your samples and the samples are on the bench where you're collecting samples, maybe you've attended to the first patient by 7 a.m. and you're still attending to patients, the sample integrity of the first patient must be maintained. You must make sure that your samples at that point of sample collection is kept at cold chain even before it gets into the lab. So for this phase of analysis, maintaining the integrity of sample before it gets to the laboratory, it's very important. And we go to the examination phase of QA in examination phase. There are a lot of processes, things that happen in the examination phase, but we're going to be taking this view. But everything that happens in the laboratory must be quality assured. Everything. So we'll be looking at standard operating procedure, the instrument calibration and maintenance, internal quality control, external quality assessment or proficiency testing, staff competency, and assess SOTA competency, temperature, and environmental monitoring. So SOPs, some persons maybe do not now follow SOP because they are used to a certain process and all that. But SOP is an approved guide, is an approved document that you work with in the lab. So every process must have an SOP, must have a standard procedure with which the patient, the staff, the scientists working on the bench needs to be guided with. Instrument calibration and maintenance. Instrument calibration has to do with setting up the instrument using a calibrator or standard, and this standard curve is standard curve is developed with which the results are produced against. Maintenance could be your the routine maintenance, daily maintenance, weekly maintenance, monthly maintenance, and of course scheduled yearly maintenance. No matter how good your system is, your quality control, your calibration is, if the machines, the analyzers are not well maintained, they will give you trouble. So it's best that every maintenance that the manufacturer has suggested for a particular equipment must be maintained. Internal quality control will address this on the next slide. External quality assessment, EQA, a proficiency testing where you check the accuracy of your laboratory report. Staff competency, and staff competency is very important. No matter how you run all this and it's in the hand of an incompetent person, the reports will not be okay, because there are some flags. There are some flags that need to be interpreted. There are some results that need additional knowledge that you need to interpret the results with. The machine will not give you that. So training the patient, the staff, is important in quality assurance. And then temperature and environmental monitoring. Temperature of your reagents, the ambient, the room temperature, and freezer where you keep your frozen maybe serum, all your temperature must be maintained. Then in our internal quality control, internal quality control is a routine process in which control materials with known values are analyzed alongside patient sample to monitor the performance of the examination system. So quality control is a day-to-day activity that gives precision. Precision is that the reports you are producing in the lab is okay, but yes, does not give you that the report is accurate, because that's what EQA does. Then we use control materials. The control materials could be 2-level, it could be 3-level control materials to check for your quality, do your quality control daily. And these quality control are plotted along on the Levigenis chart, where they are measured against the mean. The quality control, the closeness it is to the mean, the best. The value that you have, the closeness the value is to the mean, the best your control. Westgard rules, we have some statistical rules that help in the interpretation of these controls. And over time, it helps you to detect trends, bias, and shifts in your system, in your quality control. Then out of control, when they are out of control, your controls are out of ranges, you must do a troubleshooting before you release the results. Your control must be okay before results are given to the patients. If your control fails, you have to pause your analysis, pause everything you're doing, make sure that you correct what was wrong, and then rerun the patient sample. So this Levigenis chart I brought here is from our analyzer in L-Lab laboratory. You could see the mean and where the control values are. This is like a 2-level control, the normal control and the high control. Then EQA, external quality assessment. Like I said, this is the only way you check your accuracy. This is how you know that the 100 you got in your lab is actually 100 or very close to 100 every other place in the world. So EQA is the only way you detect bias that internal control cannot reveal. It validates the lab's results against the wider medical community and is mandatory for accreditation. So for us that want to dive into accreditation, ISO accreditation, you must understand that EQA is a key thing for you to even enroll for the accreditation for any test at all. So how does this work? You get an EQA material, example biorad, because we have a lot of EQA biorad in our system. So you purchase an EQA material from the agency, then you run in your lab internal. You must follow your processes. You don't bring EQA and you treat it as a god, or you want to specialize, especially run the EQA material. You have to pass the EQA the same process, the same way you receive your patient. You register the EQA material, you fill a form, register the EQA, bring it into the lab, and then run according to the instructions, the inserts, whatever instruction has been given. If you're reconstituting, you reconstitute and you run the EQA. And after which you upload your result on the portal, and the performance, the score are given at the end of the month. Is a monthly thing. Some persons is a scheduled plan. It's a monthly EQA run. Then the results are given and you compare yourself. You're compared against your peers. That's people using the same analyzer. They compare you against the test method and even mode. So IQC, in summary, IQC gives us the daily checks in the lab. That's precision. While EQA gives you the accuracy of your laboratory results. Then we go to the post-examination phase of our quality assurance in the post-examination phase. Now we are done with our analysis. The reports are okay. Now we want to release the results. Releasing the reports is also important in maintaining your turnaround time. Most persons, when you're done with the lab test, you leave it on your workbook or on the machine, and it takes another 2 to 3 hours before report is being uploaded on the LIS or maybe communicated to the doctor. So accurate recording of reports there. Result verification before release. Your results must be verified by a professional, by a competent person. So you can think of it, if you have an analyzer, you can think of interfacing your analyzer with your LIS. That way you are minimizing the result, the error that could come through the results process. Then verification before, there must be a second person that validates what you have done. You can't start and finish all. You must have a senior person that will look at your results and verify before it goes out. Critical value alerts and notification to the clinicians. There are some panic values that we get. We sign off and we keep them, or maybe you dispatch with your courier or the patient without even informing the clinician. The clinician must know. If you have, let's say you got a sugar value of glucose value of 30, you must communicate to the clinician before it even gets to the clinician. There are some values you get, you know that it is a panic value. It needs an urgent attention. You must do a call out before that report even gets to the clinician. Correct report formats and units. Any reports that cannot be interpreted by the owner is no report. So your report must be correct. The units must be okay. The reference ranges must be okay for someone to easily look at the report and interpret. Any report that has warranted someone to pick up a phone to call you to explain a particular result, it means that you did not interpret that result in the way they would understand. Timely reporting, I've explained that. Turnaround time is also a key part of this post-examination process. Proper storage, retention of sample and records. You have to retain your records, your samples as well. If it's a sample that you have analyzed and you have your retention policy. Anyway, this is based on your retention time, your policy in your laboratory. How long do you retain samples? If no samples have different retention time, it's not the same for all tests. But if you have a retention policy, you follow your retention policy. Make sure that the samples are kept appropriately. If it's supposed to be a freezer, you freeze and keep sample, because someone can call to have an added test to a previously run test. So you must preserve correctly. Data entry accuracy, we've talked about this. Confidentiality and secure transmission of results. Confidentiality is key in the laboratory generally. You must maintain confidentiality of all reports generated in the lab. So let's now check the common sources of errors. From what we have been saying all through, we already know that these things, if we not get them right, errors must occur. Errors will occur. Then we have errors in pre-examination phase, the hemolysis, lipemia, or clotting. Hemolysis, clotting. Let's say someone comes for testing and you collect the sample and it gets clotted due to poor mixing and all that. This will lead to calling back the patient for another sample collection, and then you're delaying the patient's intervention if they have anything. Wrong sample tube and anticoagulants, we've addressed this. Incorrect labeling or patient ID, delayed transport or poor storage. These are the errors. Reagent deterioration in the laboratory or lot change. So if you're running your control and you keep seeing the reagent failure, there could be a possibility that your reagent had deteriorated or the sample has exceeded its onboard stability. So it's always important to check again, know if you have exceeded, check if there has been any contamination in your reagent. Instrument drift or poor calibration, pipetting and diluting error, interfering substances like drugs and lipids. Post-examination, talked about this transcription or data entry errors, delayed or missed critical value alerts, misinterpretation of reference ranges, and confidentiality breach. So we go down to performance metrics. When you are performing by yourself, you can't mark yourself, you can't check, you can't look at your back to know what you're doing if you don't have set targets, set trackers to know how you are performing. So these performance metrics are the quality indicators. They are the objective, measurable objectives that we set to monitor and evaluate the performance of our processes in the laboratory. So in the lab, in the chemical pathology lab, or lab generally, look at the turnaround time. You must track and measure your turnaround time. If you say you're releasing your report in 3 hours, it has to be 3 hours. So weekly you track, you check what you are meeting up to. If you're not meeting up to the turnaround time, you do a deep dive, check your root cause, know what is causing the delay. Know if it is from the pre-examination phase or is in the examination phase, tackle it and correct it, and then check again. That's the way you make a progress. Sample rejection rates. You can continue rejecting samples. Let's say this one is coming from an external facility, it's not from your facility. And every time you say, no, it's clotted, take it back, it's clotted, does this correct the problem? No. It only affects a patient. It might not even affect the facility, but it's affecting the patient because the patient is going to be called back for sample recollection. And we say everything we do is for the patient's safety. So you that is rejecting this sample, you have an obligation or whatever to educate the facility where these samples are coming from. But how would you know if you're not checking and tracking your sample rejection? So you must track your sample rejection daily or weekly. Track sample rejection, check trends, check which facility has the highest rate of sample rejection, which sample are being rejected so much, why is there no enough anticoagulant on this bottle, why is it constantly happening for this particular tests and all that. So these are what you will check when you are doing this sample rejection rates. Check critical value notification time. How fast were you in notifying the clinician in terms of panic values? IQC and EQA failure. This is a must check for the laboratory. You must know the analytes that are failing, the ones that are in the warning zone. If an analyte is on a warning and you don't look at it, you don't do a root cause, you don't find out to know what must have happened, that analyze, maybe the next EQA you will do might end up failing entirely. So you must be on a lookout of your EQA reports and action them timely and wait for the next ones to see how your performance will be. Repeat or retest rate. When a staff is constantly repeating a test, it does not show competency. For me to repeat a test, it means that there's something, I repeat one, fine. But if I constantly repeat a particular test before I could give myself confidence to repeat it, to release that result, then there's a problem. There's a competency problem. You must address it. So you check, and it's also a waste, because when you keep on repeating this test, you're wasting reagents, you're wasting your time, everything you're wasting. So you have to retrain people so as to reduce this. And if you don't get to track, you will not know. So tracking all these are important in the lab. So let's look at the limitations to QA. What are the things that will make us say we don't want to implement quality assurance in our laboratory? Costs is the number one. Everybody will say it's expensive, but yes, quality is not cheap. So quality materials, QC materials has to be purchased. Calibration and EQA participation are actually expensive, but it does not equate to the quality you will get at the end of the day. So it's time consuming. Documentations, having to run the QC, wait for troubleshooting and all that before you release a result could actually be time consuming, but it's worth it. So it's better you train people, train them ahead, make sure that they understand. We have some people that when they are on the run, a QC fails, they know exactly what could cause it, but some persons will have to call their chief or go around the whole the lab before they could resolve a certain problem. So training is important as well in this case. Staff shortage and workload. If you do not have, there are not adequate staff. Yes, one person or few persons may not completely implement QA. So it's better you get enough staff to be able to share the work appropriately, and they will give you a better result. Resistance to change. Many people like this word. This is how we used to do it. It's common for people to just take that phrase and not want to take up a new innovation that comes in. A new SOP comes and you are seeing changes, and they are telling you this is how this is a new standard, this is what we should do, and you say no, I've been on this bench for a long time, this is how I used to know it. No. So resistant to change, you don't enforce people, you don't force it down their throat to understand or to take up the change. Training has to come in, because people don't accept what they do not know. So you must try from time to time to train people on quality management system, quality assurance, QC runs, EQA. Keep on training your staff so they will be in the line with what you are doing. Data management challenges. So I've talked about how we do the performance metrics, but then tracking all this in line with your day-to-day activity could be complex. But then I would advise you dedicate a certain time to take care of all these things. Know when to track, know your time, know your to-do list, and when to track, and then face your other work. Lack of management commitment. All we have discussed, if we not get the management buying in them, we go nowhere. So management commitment is important. So you, in anywhere you work, if you have not started implementing QA, you should try to get your management buy-in, advice, let them understand the essence of this QA. It can be cost effective, but then the outcome is worth it. It provides patient safety, and it also gives you confidence in whatever you do in your laboratory. So our continuous improvement. For continuous improvement, no lab runs without consistently improving itself. And how do we keep on improving in what we do if we don't do all this? We have to do a root cause analysis. Root cause analysis is in everything we do. QA failure, a root cause analysis, customer complaint, you do a root cause analysis, whatever thing. So you must do a detailed root cause analysis to be able to arrest issues and correct them. If not, you will have the same issues circling all over, and that will affect your system. Risk management is a process by which you foresee a risk, you do an assessment, rate, and then you make plans to mitigate that risk before they occur. Trend analysis I've spoken about, let's say in terms of sample rejection rates, you have looked at the trend, you look at how often this has been happening, and you arrest them and correct them, and then watch it over time again. Regular audits is important. You do an audit, both internal audit or external audits, whatever one, but internal, you can start with internal audits. You check using the checklist, use a checklist, do an audit for your entire process, and do a gap assessment. Know where you are not meeting up and correct. Feedbacks is also important. Patients, you seek feedback from your clients, your patient, the facility, whoever you are attending to. They will tell you where you're performing. You can't say, you can't be having TAT of 95% or 100% every day, and your clients are saying they are not getting the report on time. So their feedback is also important. Staff training and retraining cannot be overemphasized. Staff must be trained. They need to be continuously trained and reminded of the process. SOP review and revision. So there should be a scheduled SOP review. Each organization will have a planned review time where they review SOPs, look at what is not working, look at what is working, what they are going to add in the process. So it's also part of the continuous improvement. So in conclusion, quality assurance is not just a laboratory requirement. It is a professional responsibility. Every result we release has the potential to influence a clinical decision and impact a patient's life. For that reason, quality must never be compromised. From the pre-examination stage through the examination to the post-examination phase of the laboratory testing, every step of the testing process matters. Maintaining quality at each stage ensures that the results we provide are accurate, reliable, timely, and ultimately leading to better patient care. Thank you for listening.
Oh, that was a nice presentation. Wow, 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 wow. I really learned a lot. Thank you so much, Mrs. Blessing. Thank you, thank you, thank you. And from what she said, there's one thing I picked. What I picked is that quality assurance is not just a laboratory requirement, it is also a professional responsibility. So as health practitioners, scientists, it is not just a laboratory requirement, but it's also our responsibility as professionals. So please, can we make, I don't know, thank you so much, Mrs. Blessing, for that. I really, really enjoyed it. Thank you so much. And I know everybody also enjoyed it. So please, if you have any question, please put down your question in the chat box and it will be answered. Thank you so much. So next on our agenda is going to be Mrs. Mark Doris Chinelo, who is the chairman of the Guild of Medical Laboratory Directors, Lagos chapter. She's going to give us a good message. Ma, we are honored to have you. Thank you so much. Please, the floor is
Thank you very much, Adia and Crest, for this today and for bringing us together to come and learn. Because every day 2022 accreditation by MLXCN. Also the chairman of Guild of Medical Laboratory Directors, Lagos State Branch. It is my honor and a great privilege to me to be here today and to give this goodwill message on behalf of all the medical laboratory directors in Lagos State. With great pleasure, I wish to extend my warmest greetings to the team that have brought us together, the Pinecrest Healthcare Limited, together with Biorad Laboratories USA. For this timely webinar that you're organizing today on proficiency testing, external quality assurance, chemical pathology laboratory quality assured a way to go. Indeed, the speaker gave us a very elaborate way and detailed lecture on how to go about our EQA and our quality controls. As a medical laboratory professional, it is a factor, very key factor for us to have our process being examined, not just with what we do inside, also with an external assurance personnel. And that will give us that proficiency is a valued factor in our profession day to day. As laboratories continue to embrace international best practices, including the principles of ISO 15189, participating in proficiency testing is no longer optional, but it is now a very critical tool for a continual quality improvement, regulatory compliance, and patient safety. With all the healthcare providers here present, I know we have some medical laboratory directors here, we have laboratory managers, we have quality assurance officers, we have medical laboratory CEOs, both medical laboratory scientists and non-medical laboratory scientists. I wish to encourage us to actively participate in this webinar. Let us engage with the experts. Also apply the knowledge that we are going to gain here today. We've just gained one today in the assurance practices in terms of quality within our respective laboratories. I want to say again that I congratulate these organizers for this laudable initiative and also wish all the participants here a rewarding and impactful learning experience. Indeed, together, we can give this profession, we can give our diagnostic services a quality face. We can all give a quality result to our clients, to our patients, and that will make them to always have us in mind and coming back. With our EQA and quality control, we are assured that consistency is a better way to go. Thank you very much for having me on this call in a very special way. I appreciate and also hold this at a very high esteem. Thank you to Biorad. Thank you to Pinecrest Healthcare Limited. I remain Doris Chinelo. Over from my side.
Thank you so much, Mrs. Magdaris Chinelo. We are really, really excited to have you here. Thank you for giving us this good message. So our second presentation will be delivered by Mr. Gospel Onwadike, who is a field application executive, Pinecrest Healthcare Limited. He'll be speaking on adopting a Biorad EQA strategy for laboratory visibility and credibility. Before Mr. Gospel takes the floor, please, if you have questions, put it on the chat box. And also, if you have any question concerning the EQA prizes, we are here to answer you. So, Mr. Gospel, the floor is yours. Thank you.
Hey, Lucy. Good afternoon. Thank you for the introduction, and thank you to everyone here on this call. I'll start off by saying a good afternoon to lab scientists, to people of the lab coat, passengers, and those behind the pen, wielding and making very tough decisions. Welcome to this session of the presentation. And my name is Godson Wadike. I present Pancreas Healthcare as its application specialist. So I'm an person, so I'll be asking some bit of leeway in how I make my presentation. But first, I must thank my blessing for her presentation. And frankly, if it's me, I would have said, you know what, thank you very much for coming. Thank you for seeing your faces. I love you. Goodbye. But I'm sure my would be very, very, very displeased that I want to hear me talk. So why are we here?
Hi, Mr. Gospower. Okay, so I think Mr. Gospower's network is not working very well. So I would invite Miss Eunice to please put on presentation slides so I can make the presentation. Thank you. Anyone hear me?
Yes, we can. Yes, we
We are
can.
with you.
We're
We are with
hearing
you.
you.
We're there with you. We're there with you.
With you?
Yeah,
Yes,
good
Gospower, we
afternoon.
can hear you.
Okay, Gospel, are you back? Hello? Are you back or should I go ahead?
I can hear you.
Yes, we can.
Can you hear me?
Yeah, I can hear you. I think you're having a network glitch at your end.
Oh, can you see my screen still? Can you see? All right, let me answer that.
Okay. Gospel, if you can hear me, don't worry. Let me
Please
take it from
confirm if you
here.
can.
Let me take it from here. Lucy, can you hear me, please?
Yes, I can hear you loud and clear.
Okay. So good afternoon, everyone. We're so sorry for the glitch in the network transmission. That's what we get to experience in our country from time to time. I'm just going to continue. And today we're going to be looking at from compliance to credibility, adopting the BioRad EQA strategy for laboratory visibility and credibility. So if at any point you can't hear me or you can't see my screen, please do let me know. So by the end of this session, the participants should be able to understand the role of EQA in the reliability and credibility of their laboratory results, embrace practices that elevate visibility, identify the type of EQA program to enroll for, and understand how EQA reports are interpreted. We're going to be taking a case in point, meet a laboratory in the FCT, a district hospital lab in the FCT who was diligent with their daily IQC dedicated staff, but had no external benchmarking that was robust, affordable, and audit ready. They were passing their own QC, but they were unable to prove to auditors or clinicians. That is because if no one sees your QC, if no one sees your quality, it means that it does not exist. And that is why QCs matter. If you have your QCs running, then you know that you have reliability of patient results. And according to ISO 15189-2022, 7.3.7.2, internal quality control validates the reliability of patient results before they reach clinical decisions. So, for your internal quality, Your quality is internal to you. It is measured. You're the only one that can see it. But for external quality, of course, it is external. It is recognized. It is proven, and you can tell the story of your credibility. So your EQA turns internal quality into external visible credibility. It is external benchmarking against global peers. So your peers are not just people in Nigeria. You have peers all across the world. So, and then you have your documentation to show your performance over time. And you are accredited easily when you apply for your ISO accreditation because you have something to show for it. Let's look at what ISO says again concerning what external quality assurance should look like. So it says that the laboratory shall monitor its performance of examination methods by comparison with results of other laboratories. This includes participation in EQA programs appropriate to the examination and interpretation of examination results. So BioRad is able to provide this through our BioRad external quality assurance. And we also have an additional interlaboratory program that is made available through the Unity real time. So strategy part one, who are you compared against? We have three methods of comparison. We have your peer, we have method, we have results or results. So your peer are people who are running the same analyte as you, using the same method, using the same instrument and reagent. Your method group are people that are running the same analytes, they're using the same method, but they may be using different reagents and different instruments. While all results refer to people who are running the same analytes, but they can be using any, they can be using any method, they can be using any instrument at all. Okay? Yeah. So why does this matter? Why does it matter? It matters because you need to be sure. No lab is an island. No lab should live in isolation. Okay? You need to make sure that you have the right configuration. You need to make sure that you're getting the right feedback. You need to make sure that your performance is exposed to the faults that it may have beyond the walls of your facility. And for the BioRad EQA, we use the Z-score. So how is the Z-score calculated? Your comparator mean is subtracted from your own result and it's divided by the comparator SD, and that is how you're able to get that. So if you have a Z-score that is less than 2, that means that you're within acceptable range. Then if you have a Z-score that is less than 3 but greater than 2, it means you're on the borderline. But if you have a Z-score that is greater than 3, it means that you need help with that particular analyte. It means it's a rejection. Okay? And that can be minus or plus. It goes both ways. So how does the EQA make your lab visible? Participating in the EQA ensures that you benchmark against global labs. It means that your reports are shareable and your certificates can be seen by all. It gives your facility confidence and you can also show to your auditors and regulators. So it shows your performance versus allowable limits. It shows your bias and imprecisions. It also identifies gaps versus global standards. It supports corrective actions because we actually have the troubleshooting checklist. It demonstrates analytical competence and it turns your data into defensible quality decisions. So how do you participate in an EQA program? It's simple. We are BioRad representatives here in Nigeria. You contact us. We give you the pricing, which is actually affordable. We can discuss payment terms with you. We've been able to do that with so many hospitals and facilities in the past year. So we supply the sample to you. You run the sample. You submit your results online. We are going to onboard you. And then within 2 to 4 days, you get your sample report. And then you can sit down with your quality assurance team and review these reports. If you have any any flags, you can actually look at some of the corrective actions, do your root cause analysis like the previous presenter had mentioned, and then you repeat that process until you're done with all the samples, and it will take a period of 1 year. And by then, I assure you that the lab that started the EQA is not going to be the same lab that ends it. Because at the end of that cycle, the lab would have gained a lot of competencies and would have learned a lot. So for the Biorad EQUAS portfolio, we have a lot of programs. We have the chemistry, immunoassay, hematology, blood gas, infectious diseases, urine chemistry, hemoglobin, coagulation, and so on. We have over 136 participating countries and over 36,000 program participants. And our program is actually fully accredited by ISO 17043. So this is what the Biorad EQA dashboard looks like. It is actually very, very easy for you to navigate. Just go to www.qcnet.com. You can see home, you can see configure, you can see data entry, you can see report. This is your home page, right? You can see your lab ID, you can see the program name. So you're going to be, for chemistry, for example, you're going to be receiving a pack that contains 12 samples. So each of these tiles here represent each of the numbers that you're going to be seeing on the vials of the panels that you're going to be receiving. Okay, and then you can see the dates beneath each of the tiles, which tells you the sample due date. And of course, the colors tell the story of their own. The yellow means that you did not submit and the date has passed. The orange means you have not submitted yet, but you're still within the date for you to submit. And green means that you have submitted. Please, if you have any questions, you can kindly note them in the chat box and we can take them at the end of this session. Thank you. So by the time your sample is 7 days to be due for submission, you're going to be receiving an email notification letting you know that. And then by the time you submit, it takes 2 to 4 days, and then you get your report. And then you're also going to get an email telling you that your report is now available. Once you run your sample 1 and you get the sample 1 report, at the end of your sample 1 report, you're going to be seeing your certificate of registration. This is what you can show auditors to prove that you're already enrolled on an EQA program. So if you're here and you have run sample 1 for any of the programs, please kindly go to the reports, choose sample 1 reports under the sample reports. Then when you scroll down to the end of the report, you're going to be seeing your certificate of registration. Kindly print it out so that you can use it for your auditing purposes. Then at the end of the cycle, you're going to be getting the certificate of achievement, which shows that you have actually concluded an EQA cycle. So how does the EQA build credibility? You get to get your objective performance data, not self-reported this time. You have the Z-score validation against your peer results globally. You get to see if you have consistency of performance over time, and then your audit and accreditation ready. So once you have your data and you have consistency, you're able to build trust. Like I mentioned before, we have the 3 levels of comparison, which are the peer, the method, and all results. So the sample reports, you get them on a monthly basis, and this is what it looks like. You have the cover sheet, configuration report, the sample summary report, analyte report, and data on file report. So this is what the cover sheet looks like. Just like the front cover of an exercise book, it has the name of your facility, and then additionally, it has the exceptions. Exceptions are analytes that did not do well. The red X are the ones that failed, and the yellow inverted triangle refer to the ones that are on the borderline. They neither passed nor failed. Then these are some of the legends that we have. If you have the green tick, it means that your analytes performed well. If you have the hand that is writing, it means you have a missing result. If you have the calendar icon, it means that you submitted late. The yellow inverted triangle means that you are above the 2.0 Z-score, but you're not up to the 3.0. In this case, we're using the Z-score and not the STI. Then the red X means that you have the Z-score that is greater than 3. So this is your configuration report. It shows a summary of the lab's registered analytes and test configurations. So you can see all the analytes that you registered for, the methods, the reagents, the units. The sample summary report shows the performance of all your samples. So you can see all the ones that did well have the green ticks. You don't have to worry about this ones for this sample. And then for the ones that did not do well, like the total protein where you have the red X and the sodium where you have the yellow inverted triangle, these are the ones that need your attention. And then it means that you have to do your root cause analysis and do the troubleshooting. So you don't just get the sample summary report and the configuration report, you get the analyte by analyte report. So that means if you registered 50 analytes, you're going to be having 50 analyte reports. So you're going to be having a page dedicated to each of the analytes. So you can see here your results. Then you can see the 3 levels of comparison, which are your peer, your method, and all results. So in this case, the mean of your peer will be subtracted from your own results, sorry, and divided by the standard deviation, and that's how you get your z-score. So for this particular lab, you can see here, for their z-score, they have 0.31. 0.31, z-score calculates the distance away from the mean, right? So you can see from the histogram, you can see the results. Of course, this is a combination of all the results that were submitted. Results that were submitted were from 6.69 to 8.56. So since this lab got 7.68, so their result is here and it's somewhere close to the center, and that means it's very close to the mean. Okay, so the same thing is shown for the method distribution and for the modal distribution. So you get to check your performance at the peer level, at the method level, and at the modal level. Okay, then for this, you have the Levigenis chart. Of course, the Levigenis chart for our current reports are plotted with the z-score. So you're going to be seeing the z-score here. So you get to see each of your data point for each of your sample reports plotted here. So you can see this is glucose cycle 7, sample 11. It means it's sample number 11 out of the pack of 12. So for this, the lab had gotten a z-score of 0.31, and you can see it's quite close to the mean. And for the Yun chart, it's used for the batch statistics, which is explained in later charts. So additionally, on your analyte report, you also get to see the top 10 to 14. You get to see the top 10 to 14 performing instruments, and then you can choose. So the data on file report is a summary of all data submitted to date within a circle, and they are sorted alphabetically. So by just looking at this, you can now see that the values on yellow are the ones that have the flags that they were on the borderline, okay? Then the ones on red were the ones that failed. So in reviewing your ECOAS report, there are very important questions you have to ask. So you don't get your ECOAS report and you lock it away in a drawer. You are supposed to review it with your quality assurance team or your quality improvement team, as the case may be. So for each of your reports you get, you should ask yourself questions like, are there exceptions? Are there exceptions? And remember, you can see them on the page, on the front page. Are there exceptions? Are these consistent exceptions across multiple samples? Are the majority of my results flagged? Do replicate samples agree? Is my configuration correct? What is my comparator? Are there a significant number of labs reporting? Because for statistics, you need a significant number of labs reporting. If you're the only lab that is using that instrument, you're not going to be compared with your peer. You're going to be compared with the method group or the model group, right? How close is my result to the comparator mean? Is the CV high? Is the uncertainty close to 0? Is the percentage deviation high? These flags I'm seeing, are these significant? Do I need to investigate further? So these are all questions you have to ask yourself. Understand where there are trends. Understand if it's just a random error. Understand if it's a systematic error, right? Then at the end of the year, remember you get your sample reports on a monthly basis. At the end of the year, you get your you get your end of the year cycle report. The end of the year cycle report also has the component parts that the monthly reports have, such as the cover sheet, the data on file report, the analyzed summary report, Z-score report. But this time around, it's going to be a compilation of everything that has happened. Now, remember that you got these samples as blind samples. You didn't know what concentrations they were, right? So you got sample 1 to 12. So it's at the end of cycle report for your batch statistics that you now get to find out, oh, sample 1, sample 7, sample 10, they have similar results. Sample 2, sample 5, sample 8, oh, they have similar results. So you get to see how you were even able to perform at that level of statistics. And additionally, you're also going to be seeing your performance at a national level and also at a worldwide level. Okay, isn't that interesting? Then, on a monthly basis, of course, you're going to be doing your troubleshooting. So, we're also going to be providing you with a troubleshooting checklist that you can use to decipher what each of the flags, the yellow inverted triangle and the red X, mean. So, by the time you follow these steps one by one, you'll be able to find out where the problem is. And then for the EQUAS troubleshooting checklist, you get to check the sample receipt, you get to check the sample preparation, the sample processing, how the results were reported, if internal QC was run. You know, most times, some of these things we talk about, they are not just for EQA, right? Ideally, if an internal QC fails, you are not supposed to run patient samples, right? You're supposed to do your troubleshooting and find out where that fault is from before you should proceed with running patient samples. Then you talk about calibration, you talk about reagent. I know our speaker talked about onboard stability, very important. A reagent may have a shelf life of 3 years, but the onboard shelf life maybe 2 months. And then you have used that reagent beyond 2 months. Okay, these are some of the sources of the error. A control material may have 1 year shelf life, but the open vial stability may be 15 days. Okay, that is why it's important for us to always go through our instructions for use, our package inserts to know what the manufacturer has said. Don't assume because this manufacturer said this is how their reagents work, or that is how it has to work with the other reagents. So we have to be mindful of that. You talk about your instrument. Have you done daily maintenance, weekly, monthly maintenance, as the OEM has asked you to do? Okay, then if the sample was retested, who retested it, and all of that. So these are all sheets that are available for you to use when you enroll with us. So some of the key features that we have for our EQUAS include 17 fully accredited programs by ISO 17443, global participation across accredited laboratories worldwide, monthly year-long reporting cycles with documented performance, and of course, our programs are developed and maintained under a compliant and comprehensive QMS to help labs meet regulatory standards. And then we have professional and experienced technical service and support to assist with interpretation of results. Also, we have convenient electronic reporting options. You can report with your phone. We have the EQUAS mobile. You can report with your laptop with the EQUAS online. Okay. And then if you also have subgroups that you want their reports, you can also let us know. So for example, you have a lab in Owerri, Abuja, Lagos, and you want to be having subgroup reports, you can also let us know. So there are times people say, oh, I'm running QC, I don't need EQA. I'm running EQA, I don't need QC. Remember that QC, you do it on a daily basis, right? As you can see this graph, on a daily basis, EQA just comes in on a monthly basis to capture what is going on at that time in that particular instrument. Now imagine you're running your EQA only once in a year or twice in a year. It does not add up. EQA has to be run at least once in a month. At least once in a month. And I tell you, it is really going to improve your processes. So remember that lab we talked about initially. Before, they didn't have any robust, affordable external benchmarking to show the world what they were doing. And so they had an open audit gap. But after enrolling on our Barrad EQA program, and their discrepancies were caught early, they passed their audits. They were recognized among the top performing government labs in the FCT, not just in the FCT. We have a lot of success stories here in Lagos, we have a lot of success stories, labs that have partnered with us and they are currently ISO accredited. Okay, we have some pictures that we can also show you. Most of the labs here are partners, and we are so proud of all our partners. So, in conclusion, every lab has to implement strong IQC. That means that they have to build a solid internal quality control foundation. Secondly, they have to enroll in EQA, Biorad EQA. And so, in so doing, they are able to add external benchmarking against global peers. Thirdly, they have to monitor their performance monthly. This is very important. Then, not just about getting the reports and keeping them, you have to use these reports to improve your processes. And then, of course, feel free to showcase your results. Show your outcomes to the auditors, to clinicians, to stakeholders. Celebrate your wins. Snap your pictures. Remember that quality ensures accuracy and EQA ensures recognition. So we encourage you to partner with us. If you need a flexible payment plan, you can let us know and we would be glad to partner with you. So at this point, I'd love to thank you so much for listening as I hand over the cursor to Lucy Dansafo. Lucy Dansafo, over to you, please.
Thank you so much, Miss Eunice Onchekwa. Thank you, thank you, thank you. I've learned a lot, and I'm sure everybody here in this call has also learned something. So thank you for giving us this better quality talk. So, like she rightly said, if you have any question, you can put it on the chat box. If you want to get our EQA, Barrett EQA, you can talk to us. Would give you the quotes and everything. Like we said, you need to really have a good quality. A good quality ensures a good result. So thank you so much, everyone. And now we are proceeding to the question and answer section. To moderate this section, it's my pleasure to invite Mr. Samson Chukuma, who will be taking us through the question and facilitating today's discussion. Mr. Samson Chukuma, over to you. Thank you.
Hello, thank you very much, Lucy, for anchoring this webinar. Thank you very much. Can I be heard?
Yes, we can hear you.
Okay, thank you very much. Thank you very much. So we have some questions here. So while some person are still pending, putting down their question in the chat box, I have 4 questions for Miss Blessing, the first presenter. So, Blessing, can you hear me, ma? Hello, ma, can you hear me? Miss Blessing, please, can you hear me, ma? Okay, the question we have for her here. First
Something I
question is
can hear
coming.
you. I think the host just allowed me to unmute my mic now. I was trying
Okay,
to
thank you.
unmute. Yes.
Okay, thank you very much. Thank you very much, ma. So the first question is coming from Mr. David. So he's asking, is there a way the cost of quality assurance can be minimized, especially in the case of small laboratory? I think this question goes down to you and equally to Eunice.
I think
So
the
second,
question is to me. So, sorry, my blessing for cutting in. So the question is to me, and I believe I've also answered that question in the chat box. So, because of the human side we have to our business, and because of how important quality assurance is across boards, we encourage labs to enroll, whether you're a small lab in quotes or a big lab. Okay, so our prices are well discounted, and we can always discuss a mutually beneficial payment plan. So we're going to be dropping a link on the chat box where anybody who is interested in enrolling with us can just fill that link, and then we get your details and we reach out to you. Thank you, Samson. Please proceed with the other questions for Madam Blessing.
Thank you very much, Miss Eunice. So, David, are you okay with the answer? So the next question is directed to Miss Blessing. Mrs. Blessing from Uzoma is asking whether EQA abbreviation is normally used. The question said EQ abbreviation is normally used for two things in the lab: external quality assurance and external quality assessment. Please, are there difference between the two? Do they mean the same thing? Should I repeat the question, Mrs.
I
Blessing?
heard you. I heard it. Are you asking all the questions or one
Yes,
after the other?
yes,
Can I get?
I want to ask all the questions so that you can react to them once.
All right. Thank you.
Okay. Another question goes to Miss Blessing from Mr. Chris Delight. The question says, can a QC data be numerically acceptable in the laboratory but still clinically unacceptable? He asks, can a QC data be numerically acceptable in the laboratory but still clinically unacceptable? So the last question for Ms. Blesson is from Mr. Bernard.